Loading.
We're live.
Okay, good afternoon, all. Thank you for being right on time for the second meeting of the 911 Specialist Work Group. I want to acknowledge my friend and colleague, Mary Beth Carosa, who has been working on this. And I see Delegate Teresa Riley, and I think Delegate Jamila Woods is going to be joining us as well. So, and then all of you for all that you do and the expertise that you bring. But since we're in the middle of the legislative session, I got to give a shout out to my colleagues. Arnold and I have been working to prepare for this meeting. And so Arnold, maybe if you want to pull up the agenda first. Okay. So this is what we'd like to get done. And Arnold, if you're able to make it a little larger for those of us who have eyeballs that are, yeah, there we go, older than 30. This is an idea of what we thought we would cover today. I don't expect this to be a supremely long meeting, but we do want it to be comprehensive. It is our only meeting until May, and then everyone will have some homework between now and May, but this is what we want to get done today. So I'm going to read it briefly since not everybody listening or watching may have the ability to read it. So we're going to start with a call to order and opening remarks. We're going to review the proposed survey that's going to our PSAPs, or public safety answering points, which are 911 call centers. We're going to talk about the Next Gen 911 Commission. Review the draft of the interim report, which is going to the governor, the president, and the speaker. We'll talk about how to schedule for our next meeting, which isn't until May. And then if anyone has anything they want to add, we'll close up and adjourn. So is there anything that any of you see as missing from this agenda? I see nothing. So, and hear nothing from anyone. So you can raise your hand, or we can be more informal if you want to speak out. That's okay too, until such time as that becomes too challenging. Arnold, why don't you bring up the review of the proposed survey? And while you're doing that, I'm just going to explain what that is. We are wanting to gather data so that we know the range of what we've got now and know what we're dealing with, and that will help us sort of explore options. And Arnold Aja, who is our Department of Legislative Services, DLS liaison, along with Lisa Tran, working on this with us on this project. And I'm gonna read it because not everybody is able to read who may be watching. So I'm just gonna kind of speed read it. Cecilia and anyone else, if you want me to do it more slowly, let me know. But the work group needs to identify recruitment and retention challenges. I think we might want to include training on that, recruitment, training, and retention. That affect the 911 specialists in Maryland, and make recommendations to enhance and support them. We are looking for information from each PSAP. Again, that's our 911 center in the state, in order to inform our efforts. We are asking them to fill this out. It's an Excel, and give us as much data as they can. It does ask for the survey to be submitted not later than March 15th. So we're giving them 6 weeks, which is, I think, a long time. Cass, I see that, I don't know how many other, Tania, Cass, and Shar. Thoughts on how long is a reasonable deadline? Shar, why don't you start? Like, what do you think? Is that 6 weeks? We're gonna have to do follow-up and remind people. The question is, what's the right period of time?
I think it's reasonable. I think it gives us plenty of time to gather all the information, make sure it's accurate and well prepared, and submit it. I think it's a very reasonable amount of time.
Okay. Cass? Is she in the room?
I am,
Yes.
I agree, it's reasonable.
Okay. Tania, you good?
Same, I agree, it's reasonable.
Okay. Anyone else? Does anyone think it's too long or too short? Are we good with 6 weeks? It's a little, yeah. Okay. So it starts by asking for the county, the name of the preparer, their title, phone, and email. Go ahead. And then the survey, which is on the next Excel tab, asks for its data, the number of people who are employed, the number of vacancies, whether they are represented by a union, and if so, which one, how many were hired, did they come from another PSAP in another county in the state, did they work in another state as a 911 specialist, did they come here with absolutely no experience as a 911 specialist, and then did they work in another public safety field? And then how many have left? And how many have retired? How many have, and then how much time did we retain them? So were they with us, with our PSAP or something for less than a year, less than 2 years, another job in another PSAP in the state, if you know that, and then in another state. So we want the basic outline. Okay, scrolling down. So retention is so critically important. So again, how long have people stayed? 0 to 2 years, 2 to 5, 5 to 10, more than 10. Do they live outside the county, and do they live outside the state? And that's especially a challenge on the Eastern Shore, where everything is very interconnected. What are places doing to recruit? And I know that I talked to County Executive Jessica Fitzwater. Frederick County is doing something interesting, and that's being launched. Anne Arundel County, County Executive Stuart Pittman was doing signing bonuses. I think we want to collect all that kind of information, and there may be others that are doing creative efforts to recruit. Salary, training, what's required in terms of training, number of work hours, the number of shifts, the average length and maximum length of a shift, and all that. And then we want to know about wellness. So the 911 Commission was working on easy access to mental health care. We want to know who's doing something creative and effective in their county. Next section, is the PSAP accessible for people with disabilities? And I think that's important to know. What benefits are being offered? So that's in addition, so healthcare, retirement, vacation, vesting, all that. Health benefits, we ask about other benefits, workers' comp, and then anything else that we should know about. So that's the overview. That's what we're going to ask folks to tell us. Senator Carrozza.
Thank you, Madam Chair, for this work, the survey, and a good solid agenda for us today. A couple questions, and this is more for just kind of understanding the scope of the project and additional feedback we might want to include in the survey. One, I know that we have this, this is seeking information from every public safety answering point in the state.
Mm-hmm.
So what is that number? Is that municipalities, counties? What are we looking at? And then two, on the survey itself, is there, we're collecting a lot of good data with this format, but is there also an open-ended area that we can ask what, in their view, have been their biggest challenges, to try to just hone in on if we see consistently the same 3 or 4, it might help us prioritize. So just those are my 2 questions.
I like it. So the last section, section 10, is there anything we can do to improve recruitment and retention? So do we want to have a separate section, Senator, that would say what problems have you encountered, or do we want to mush those together? What are your thoughts?
So I think where I was coming from on section 10 was, so we're asking them for their specific, recommendations, which I think we need to ask, but, it would be helpful, I think, to know what are the challenges, that are driving those recommendations. So if we come, as we review the information and we, I'm thinking we can prioritize the challenges that would drive us to prioritizing the recommendations.
Okay. So Arnold, I'm wondering rather than, and I know we're using an Excel document as the tool, but I wonder if we could have sort of a big box, sort of problems that you've encountered and then solutions, things that you've tried that have worked, and maybe also things that you've tried that haven't worked. Would that capture some of it, Senator? Okay, so we can work on that. Arnold, you've gotten that?
Yes, we'll
Okay,
make the change.
dynamite. Cecilia Warren.
Thank you, Senator. I have two minor comments and one a little bit longer suggestion. The
Mhm.
first comment in section 5 regarding the hours worked and the shift, it might be helpful and revealing to know what the shift schedule is for that municipality or that jurisdiction. Is it 24/72, 2 days, 2 nights, 4 off? And we may be able to glean some helpful information from that. And then I also think it might be helpful to ask to have an organizational chart included. Some PSAPs fall under the domain of the police department, some under emergency management, some are standalone. And so that could also be helpful in comparing some of the data. My next comment is a little bit
Hold on, Cecilia, wait, can we just
Yes.
do you mind if we do your first one first?
Sure.
So I think that's really smart. And the org chart, Arnold, maybe we would ask that they attach that to their response in a separate document, and I suspect that already exists. And Cecilia, one of the things that your comment makes me wonder about, and again, you guys who have actually been in PSAPs, I wonder what you think of this. The average number, the maximum length, the average length, all that. What about when there's an enormous snowstorm or some emergency? I assume all sort of typical practices go out the window. Is that true? And do we want to have another section on that? Because I know some PSAPs like SRR, you've got beds and stuff, and I think there was someplace on the Eastern Shore that also had beds so that people could actually move in. But what do we do for their childcare challenges or anything like that if they're stuck at the PSAP? Thoughts on that, Cecilia?
Oh, I agree.
Okay. Anyone else have anything? We're coming back to Cecilia, but while we're in section 5, anything that's missing or needs to be tweaked on section 5? It has average number of hours worked per week, maximum number of hours worked per week, average length of shift, maximum length of shift, average length of time between shifts, and minimum length of time between shifts. Stacy, HR Director, Worcester County.
So good afternoon, everyone. What my suggestion would be about the breaks. There are some counties that do a 10-minute break every hour, and it's a designated break time that they can step away and walk away. We don't do that. I would be interested in learning that. And then my other comment was on the training. It really does take, because we have 4 different consoles with call taking, police, fire, and then dispatch for emergency services, the ambulance. It takes so long to train somebody new. I would love to hear, how are people accelerating that training? Thank you.
Thank you, Stacy. So I'm going to defer to the PSAP experts on this as well, but there are a certain number of hours and you have to get certified in police, fire, paramedics. So there's some acceleration that I'm guessing could be managed, but some that would not be. Tania, do you want to speak to that? Tania, if you're speaking, you are neither audio or video at the moment. Okay, Shar?
We have a certain amount of time that it takes to become trained for dispatch. And as mentioned, we're trying to accelerate the process. Right now, you have to become 911 certified before you can become the dispatcher, because the 911 is the foundation of everything. So it would be interesting to find out how the structure is throughout other PSAPs, to see if there is a way of moving people through the dispatch process either faster, or if it is a 911 to law dispatch to fire EMS dispatch path. So that would be very, very interesting to find out.
So, so Shar, I remember when I started my 911 journey, one of the concepts was that the then ENSB, the Emergency Number Systems Board, would underwrite all the trainings, and then the 911 centers would be able to sort of let their people come to that training. Is that still the way it's working? And how often are each of the new trainees taking a statewide, or can they go elsewhere or private or out of state? What's the current status?
Right now, there is quite a bit of state support for the training. I think what we're discussing here is the agency specific, the jurisdiction specific processes, which is how do you handle the municipalities? How do you handle each volunteer fire station? It's the agency specific information as opposed to the global process.
So I think this is I wonder if we need a whole section on how many other entities is your 911 center responsible for. So in Prince George's, it's everything from University of Maryland, College Park. In Montgomery, we have, NIST and NIH and, federal agencies. And, in St. Mary's, they've got Calvert Cliffs, nuclear. And I mean, there are all these different, folks who have their own security systems, their own emergency systems. And so learning how they get together and how they work together, collaborate, is that relevant to our work, or is that beyond the scope? And I'm asking anybody, please, anybody pop in.
I think the dispatch function could be beyond the scope. However, there is the complexity within the 911 area, simply because you have to apply the different processes when the 911 call comes in. So if it's making up something, University of Maryland, you have to know how to handle that. If it was handed off from the University of Maryland, if we need to triage through the protocol and then transfer, it does become a little bit more complex. But again, that's agency specific. And if we're going to try to concentrate on a statewide function, we may be throwing in very complex processes and procedures.
Okay, Tania, I see that you're back. I don't know whether you heard the question that I popped to you earlier.
I did not hear it. Sorry about that. I had to run out real quick. Sorry.
Yep. Okay. All right. Anything that you want to add here?
I think Shar hit it as far as the complexity of it. I think it's going to be a little bit complex if we start getting into those other agencies in the scope, because of different levels. I know Baltimore City, we deal with a lot of different colleges, hospitals that have their own security and things like that. So that's just digging ourselves into a rabbit hole of going further deep down into it. Let's just stick with the actual PSAPs in itself, the primary ones. And if we ever find where we need to go moving towards the secondary, then we can, but let's stick with primary.
So for
first.
those who aren't experts, and I am not, but
Oh, I'm
I
sorry. I'm
know
sorry.
enough. No. So primary are our 24 counties, but for some of my colleagues and some others on this call, secondaries might be like the city, Ocean City, or Annapolis, or College Park, or a federal agency, or but we have 24 counties. Christy Collins, do you want to add anything since they are your constituents? And to the degree, you guys, that you can try to stay on camera, because I don't want the awkwardness of calling on someone who has stepped away for a bio break or something. So to the degree that you're willing to show your face while we're having the meeting, that would be great. Dr. Collins, thoughts?
I agree. I agree with everything everyone said here. I think the complexity is sticking to the, recruitment and retention efforts. What is at the root of that? When we go into the backups or the secondary PSAPs, as you've described, it really gets into more agency levels where, we have state police barracks, and it's more of a need-based because of the geographical location that's covered. So I think you're on the right path with just sticking with the primary PSAP, especially obtaining this information. Maybe a section highlighting if they so choose. But I think if we stick to the 24 primaries, I think you're going to be better served, because I think that's where the retention and recruitment efforts seem to be having some issues.
So that is a really interesting that you just referenced. And then Major Gregory, I'll come to a second. Is there something hypothetically that some of our secondaries are doing that we can learn from? I mean, I hadn't even been thinking about including them, but I wonder about that. And then, but I think, Arnold, it might be interesting to have just a quick open box of, are there secondary PSAPs basically that you collaborate with, just as a information gathering? And then we can follow up afterwards. But if we go too deep in and this looks too complicated, our response rate might go down. So we're not looking for how many and tenure and training in, the city of X. But anyway, so Senator Croza, did you have a thought on this?
I just wanted to, I think, kind of clarifying, we understand it's the 24 primary, but I do believe that there might be some practices that if those other secondaries participated, could actually inform our work. And I don't know if that's, if we opened it up a little bit more from the information standpoint, and I would be willing to, maybe encourage some of those.
Yeah.
I know the first priority is the primary, and I think all of us can be involved in ensuring that the responses come from the primary. But
Yes.
I'm willing to just thinking that I'm a big believer in there may be some good information that would be helpful, inform our work, and maybe making that effort to get the some of the secondaries to participate.
Okay. Thank you, Senator. Major Gregory, I'm sorry. I went with the senator first, please.
Oh, no problem. Thank you. And yeah, I was kind of waiting for all that to flush itself out, frankly, because obviously multiple points were made that are very valid. But what I will say is we are suffering as well with the retention and recruitment. Some areas less than others. So I think Dr. Collins, bringing up the statewide and the just talking about the secondary in the fact that we reach, across the entire state, we are seeing it globally, right? So some of our counties are struggling more than others. Frankly, I use information that I receive on the numbers board, the 911 board, to help us with it, potential things that we could do better if there are things that we're not doing that are being done within the PSAPs, if I'm aware of it. So I think we're struggling too, and I think it would be a great idea. And maybe there are some other secondaries that are having, as the other senator said, maybe there are some other secondaries that are having some success with
Yep.
different things that maybe we haven't thought of or our recruitment staff hasn't. So I think it would be a benefit if we could to get some of that feedback.
I kind of agree. I think we've got to not make this an enormous project that is unmanageable, but I agree with what I keep hearing. So I hear Dr. Collins saying some version of perfect is the enemy of the good, but I also hear Senator Carozza and Major Gregory saying there could be value added. Dr. Collins, go ahead.
I just wanted to add a few numbers just so while we're thinking through this. It looks like it was roughly 79 that we have as far as deemed as backup and or secondary. So I just wanted to, that was FY24. So I just wanted to provide you some numbers
79, that would be in addition to or including the 24?
in addition to.
Okay, that's helpful. So that's a lot of extra work. And a lot of smart people who we could learn from. So how do we want to leave this? I'd like to move on. Major Gregory, is your hand still up or is it a new thing?
Down now. Sorry about that.
No, all good. Okay, so thoughts? I think 79 is a lot in addition to 24. Do we cherry pick? Do we send it to everybody but not push on them too much? Those who respond, we learn from. Give me some thoughts. Major Gregory?
Hand up again. Dr.
Yes.
Collins, that 24, the 79, is that including all MSP barracks or is that counting MSP as one?
So that is what the PSAPs had shared with us in FY24 for the FCC reporting. So when you ask, everything is ran through the primary PSAP. So when we're
Right.
reaching out to the primary PSAP, it's really up to them because like this year, we had a huge initiative on the Eastern Shore. I believe Wacomico added 3 more secondaries. So it's constantly evolving based on the needs of that
Right.
geographical area. So I don't have FY25 just yet, but it's coming up for reporting soon.
Okay, I think maybe I wasn't 100% clear, but I think probably what's happening is in that 79, there's probably a good many of our barracks considered individually, right? So MSP may be replicated throughout the different PSAPs. So it could be that number is maybe 20 less. I mean, we have 23 barracks, but it could be 20-ish less. Maybe it's actually 59 because everybody's accounting for the, MSP. I can't say. That was really kind of where I was going with that. So maybe it's not as big of a number. But anyway, just a thought.
Dr. Collins, before I call on others, do you know if that includes University Systems of Maryland? Does it include all of the campuses separately? Does it include all of our federal institutions? Can you give us a sense of what else that 79 includes?
Can you hear me now?
Uh-huh.
Okay. That includes because secondary and backup PSAPs, as you know, most of them are not widely available. So we count on them to report to us. So we don't have significant addresses or specific locations all the time. But that would include, and we can get you a list on that. Cass can help out with that, just to make sure that we have the accurate information we're sharing with this work group.
Okay, so my suggestion, and I see that we've got 2 more hands raised. My suggestion is that we try to flush out and see what that 79 actually is. I can say in Montgomery County, our backup certainly has an address and is a location, but the same 911 specialists who work at the primary would work as the backup if there's a need. And I think, but the difference in Baltimore County, I remember from my visit there, that they keep both going concurrently or used to, and I assume they still do. So again, it's when we're looking at just 911 specialists, it matters less what office they're in, unless there's a question of ADA accessibility, which was in the survey. Senator Crows, are you okay if I go to Delegate Riley, who hasn't spoken
Sure,
yet?
and then I just have a quick one.
And then, okay, and then Cecilia, we're still in this one section. Delegate Riley?
Thank you, Madam Chair. Yeah, I was just thinking, hearing everybody talk, and since, we don't know the exact addresses for all of those 79. My thought was, how about if we just, stick with this current survey that we have for the 23 and Baltimore City, go forward with that. And then when we get that, I don't know if we have time enough, but then maybe we could come up with like a synopsis of that report and then send it to the other 79 and said, hey, this is what we've done. Is there anything, additional that you could possibly add that maybe we overlooked? And maybe come up with a shorter survey for them that would be particularly, how do they get their calls, and, what do they do differently from what, we see from the report that we gather. Just my thoughts. So.
Okay, thank you, Deliet.
Mhm.
Senator Croza?
Yeah, I just wanted to highlight, and I did want to share this with the group. One of the ways that I got involved in this 911 specialists recruitment and retention issues was from the Fruitland Police Department. They brought some of these issues to my attention, and it's also one of the reasons, as Chair Kagan knows, there's been an effort to look at LEOPS, law enforcement pension system for 911 specialists. So I just knowing that some of these issues, came from that source. If there's any way to include some of these secondary and not make it onerous, and I think there's a way to kind of thread the needle on this, I would kind of make that request.
Okay, so here's what I'm going to suggest. I think we need data as to what the 79 look like. It doesn't really cost us more to do 24 versus 31 versus 52 or whatever, but I don't think we want to do, I don't think we want to add on DLS's, the Department of Legislative Services. I don't think we want to add to basically triple the amount of work potentially, or I guess quadruple from 24 to 100 and blah, blah. I didn't even do the math. So why don't we start, Dr. Collins, if you and Cassandra might be able to give us the list so we can look at that. And if there's a teeny tiny secondary that has 3 people, that might not be so much value added, and it might look a lot different than Baltimore County's PSAP or something primary. So let's take a look, and then we can make some judgment calls. My suggestion in the way that we're looking at this, rather than waiting until May or convening another meeting, maybe what we do is an email with a modified revised version of this, and that would include the list. And then we can just do email sign off on, yes, that looks good, or what about this one that I'm aware of, or something. Does that make sense so we can move forward? Any objections to that? Or can I get some thumbs up or thoughts? Dissent? Okay, Shar? Did you turn on you're muted. Okay, you showed me. Okay, I seen thumbs up. Arnold, if that's okay with you, we're committing you to doing another email here, a blast email with an updated version.
Sure,
So,
definitely.
okay, that's great. Okay, if that's okay, we'll move past then this section and go back to Cecilia.
Thank you, Senator. In respect to everyone's time, I'll make this abbreviated. I think these questions, they're terrific questions, especially for the purpose of retention. But I believe we would benefit from some granularity of information for the pre-employment activities of, what is required. This would be part of recruitment. And so perhaps a checkbox of, what does that jurisdiction require of an applicant? So the critical test, personality test, some of them do, some of them don't.
I love that.
Yeah, the interview, some require a polygraph, medical exam, background check, and driver's license. So that was my list of requirements that may be present. And
I love
also,
that.
thank
And
you.
I want to just add that there is conversation about using AI to pre-screen artificial intelligence, and whether that's something that we think is value added, or maybe screening some people out who are not, who would be good and AI is not. I'm sorry, but Cecilia, what else were you gonna add?
I thought the AI was absolutely on my list. If that could be worked into, do they use AI in the pre-employment, part of the hiring? And the last question is, what is the rate of attrition between the time somebody applies for the job to being hired? So how many people are they losing in the pipeline?
Mm-hmm.
That was it. Thank you.
Those are great questions. We will want to incorporate, I think, a lot of that. Thank you. Does anyone have anything else that they think is missing from this survey? Okay, Randy Linthicum from MIMS.
Thank you, Senator. Just a thought for consideration is possibly something on information on the working conditions and enhancements that have worked. Like I understand some centers have added exercise bikes or treadmills at the stations, so people have an option to, rather than sitting for 12 hours, they take frequent breaks or exercise.
I love that. I have seen stand-up desks, and I have seen, I think it was Dorchester. No, not Dorchester. I think it was Talbot that had what's it called? Give me George Jetson here. The walking things.
The treadmills?
Treadmills. They had a very silent treadmill, and so people were on the phones and staying fit, because obesity and snack foods and sedentary, it's a challenge. So physical and mental health care, I think, are two of the items we definitely want to cover. So yes, thank you, Randy. So again, Arnold, maybe we can just have what sort of amenities or do you offer for your 911 specialists? And we can even ask among and give examples. Okay, is there anything we haven't covered in this survey that seems missing to anyone here? Okay. Arnold, shall we move on?
Yes.
Okay, you can stop sharing screen. Next item on the agenda. Thank you. Look at that. You're ahead of me. Okay, so the reports. Do you want to put the link where people can find them in the chat? And then we also want to, so I'll speak to this for a moment here. So for 4 years, I chaired a statewide Next Gen 911 commission, and I was very lucky to be able to work with people like where'd she go? Like Shar Flaherty, like Cecilia Warren, like I'm trying to think who else is on this, who brought their expertise, and it was an amazing group. We did annual reports in conjunction with Mission Critical Partners, a nationally known consultant. And then we ended up passing, I think, 13 or 14 new laws. So the homework assignment, and this was not my idea, it was Arnold's, that we take session. And for those of you who are not legislators, it's just, homework assignment to just read at your convenience. For the rest of us, it'll be between hearings and on weekends and whenever we can do it. But knowing where we came from and what's already been done might spur some ideas. It will also help you. In each of the reports is a glossary and of terms, and you can tell we're already using PSAP interchangeably with 911 Center, public safety answering points. To some of you, that's new. To some of you, you say it every day. So it'll just make sure that we can do some shortcuts. Arnold, do you want to put the link in? Well, we don't have chat enabled here. So how do you want to do that? Do you want to bring up the link and show what it looks like?
Yeah, I will eventually share the link with the members again.
Okay.
But I'm right now just I'm showing the first report
Yep.
as of November 2018.
Yep.
Um,
So it's pretty readable, you guys. I just want you to know, I believe in plain English. And so it's not a dense bunch of jargon. I think you'll find it pretty accessible, regardless of your background. Okay?
There's
Any-
4 reports in total. So also we will send the members the December 2019 report to read as well, and December 2020 report, and the final report on December 2021.
Yep. Great. Thank you. Thank you for putting those out there. They're also all available on my website, which is, I'm not trying to be self-serving here, but CherylKagan.org also has our notes from 2022. When we didn't do a big formal report, but we did do a wrap-up memo with a little bit more. Okay, moving on to our agenda, unless anyone has questions or comments about the reports. You've got until our May meeting. So Arnold, I think the next thing is the draft of the interim. Okay, so let me just run through this really fast while he's pulling this up. We are required by legislation that we send a letter to the governor, the president, the Senate, and the Speaker of the House. And so Arnold drafted, and then we collaborated on this to report on our very brief history and very modest accomplishments though so far, because it took a while to get all the right people in the room and then to schedule. We've had, kind of a modest report to send, but we are required by law to submit. So again, reading for those who aren't able, in accordance with, and it's addressed to the governor, the president, and the speaker, and it just says, in accordance with, and it cites the law, we asked for an extension of our time, and here's the report. And what we're doing is reviewing the reports from the 911 Commission. We're identifying recruitment and retention challenges. I think we also want to put training in there at some point. We are looking to we are looking to make recommendations on the effectiveness and viability of uniform incentives, offerings, or practices employed in other states, and I think we want to say other counties or states, to attract, support, and retain individuals in 911 specialist roles, determine any barriers and any other issues that we think could help them enhance and support career 911 specialists. And the work group has had 2 meetings, and that was December 19th when we all convened and introduced ourselves, elected a chair, came up with a plan and all that. And then this meeting here, January 27th, focused on reviewing the survey that we're sending out and this report. And then I'll read the final paragraph. As mentioned above, in the plan discussed at the December 2024 meeting, the work group plans to reconvene in May of 2025 after the legislative session to review information gathered through the survey and to plan the work group's efforts over the subsequent months. The work group looks forward to working to produce findings and recommendations in its final report, which is due December 1 of 25. So I just want to remind you guys, we're on a really short turnaround time. So this is not a forever and ever. So any of you who are connected to PSAPs, we really want them to get their responses to us right away. So final report by December 1 that will benefit current and future 911 specialists in the state and the state's public safety as a whole. It is signed by me on behalf of the work group, sincerely, Cheryl C. Kagan, Chair, and it is CC'd to members of the work group, the Senate Chair, the House Chair, the head of the Department of Legislative Services, and her deputy. With that, Senator Croza and then Cecilia.
Thank you, Chair Kagan. And I think you really summarized this in a tight way, as you always do. And I agree with adding training to the 1 point. I just wanted to make clear that these recommendations, I'm assuming, I don't know if we need to clarify it or I missed it, but that the recommendations not only would be coming from other counties and states, but from our survey, from the work of our survey. And then 2, I thought it might be nice to attach the members of the work group. I know when I usually see some of these reports, the first question I have is, who's on that? Do I know anybody on that? Is it state? Is it county? Who is it? So if it would be possible to maybe attach that, it might be a, good resource for us to have on hand.
I think that's a really good suggestion. I'm assuming no one has any objections to that. Arnold, you could just copy and paste that and maybe at the bottom put attachment sort of work group, list of work group members and just with their brief, when I say bio, just their title. Not their
Yes.
whole bio. Okay, I think that's a good suggestion, Senator Carosa. Good job. Cecilia?
Thank you, Senator. Just wanted to say this is a nice, concise report. We don't have any new bodies of knowledge to provide, so I think you did a great job with what we do have. Thank you.
Of course. Okay, anyone else on this? If not, we are beginning the process of wrapping up here. I have a few questions here. We're going back to the agenda. I wanted to brainstorm with you all. How do we best figure out our next meeting to maximize attendance? And the problem is, as I told Arnold, if you asked me right now, May 18th at 3 p.m., like I have no idea what's going to come up in the next several months that's going to make that date perfect or terrible. And so how far in advance should we ask? DLS does not do Doodle. I like Doodle a lot, but maybe someone else has a professional Doodle or we can just do it ourselves informally. Or Matthew, maybe we just get the professional Doodle or something. What works for you all? The one thing that I hate is everyone in the two, and then everybody replies all, yep, works for me. Yep, no, I can't do that, all that. So that's my only veto. Arnold, please.
Maybe if Cass, because she's also staffing as our MDM counterpart, I don't know if they use Doodle or any other.
That's a great idea. Christy and Cass, do you guys have Doodle or some other, what tool do you use? And you guys, for those who don't know, these wonderful women are with the 911 board, our statewide 911 board. Dr. Collins is the director and Cass Onley, who just retired as head of the Montgomery County 911 Center, is now deputy, which we're very excited about.
And I am too. So a couple points on that is no, we do not use that program in-house. Obviously for this, we can create something to use so that everybody's, like you said, in a central location and kind of get an idea of maybe 4 or 5 dates, what works for everybody. So we can do that. Also, I do have a resource for the 16th annual fee report state filings for FCC. I can send over to Arnold. So that's part of it. It's out there. Anybody can view it. And I stand corrected. It was 71 for a total of 95. So 71 or I sit corrected. 71 plus 24 is 95. And that's what's listed on this report that you're going to see.
Look at that. We've already taken away 8. See, Arnold, the load is so much lighter.
But it is a great report that has other things as well that this group may find of interest. So I will send that link over to him. But yeah, we can follow up with Arnold and Cass. Are you on there? Yeah, she's still on there. So I'll work with her and we'll get something out for that May timeframe.
So I don't want to take the time in the weeds here. So we'll figure out a way to communicate. The question is, with all of our busy schedules, what do you think? A month in advance? Longer? Shorter? Somebody just speak out. Don't even raise your hand. What's the amount of time to get something on your calendar? How far in advance to get something on there that is you're going to be reliably able to commit to?
I think a month.
A month to 2 weeks, yeah.
A month?
A month.
2 weeks? A month? So if we heard a month and we heard 2 weeks, do we compromise and say 3 weeks or do we stay with a month? Does anybody care?
Stick with the month.
Okay, all right. A month in advance then. So look for it. Let's say fairly soon after adjournment. So if we're back to you guys, right after adjournment, which is April, whatever, 7th, 8th, 9th. Look for an email then, and it'll be second, third week, fourth week in May that we'll be offering options, if that works with folks. Okay. Lastly, is there anything we haven't covered? Any burning issues that that you want to be heard on this call, on this Zoom? Okay. Arnold, is that it? And we're looking for a motion to adjourn, or am I forgetting something else? Okay. Closing remarks is just, I think we're on the path and we've got a lot of work to do. And luckily we've got Arnold and Lisa to help guide us and smart people in the room. So I'm really hopeful. Know that we've got legislation that we'll be looking at, and it might be that we let you know what's coming up, and Senator and delegates, we can have a conversation. We don't want to hound you with too many things that are not directly for this commission's, this work group's mission, but we also want to keep you in the loop since it would be happening before we meet again. So with that, if there are no other questions or comments,
Motion to adjourn.
is there a second?
Second.
Okay, all those in favor or any objections? All right, thank you all for your time. Appreciate you. And Arnold, thank you for all your work. Stay safe, everybody.
Thank
Bye-bye.
you.